This is another in the series on The Doctor is In. It's helping you understand what telemedicine is about because we've got to get used to it as we continue to stay indoors to avoid coronavirus. We've already done a couple of videos on it. One of the first ones was e-prescribing. How does electronic prescribing work? What is it? And what is the impact on quality? It's a huge improvement in quality for prescriptions. So we went into a little of that on the other one. Now we're going to do electronic home record, home and summary. We've covered some of the basics in the health record, but let's go today in this video and look at the summary sections of the EMR, or electronic medical record. As you remember, we use Practice Fusion. This is the practice dashboard, and here's the navigation section. The practice dashboard basically shows you a lot of the key sections that you need to know when you're functioning within the chart. One of the first things that they've added right up at the top now is, guess what? CDC guidance for coronavirus, COVID outbreak. Here's what docs need to do. And all you have to do there is click on that and you start getting into the CDC homepage. That's not what this video is about. This video is about navigating through the electronic medical record. Again, so you know what's going on when you get an electronic or telehealth visit with us. They have sections on controlled substances and e-prescriptions. We don't do those. We don't do a lot of imaging. We have some imaging, but we handle it in a slightly different component. The profile is not really something that we need to focus on right now. You have a whole section of tutorials available for docs and nurses and medical providers as they begin to learn how to go through a medical record. Your doc may be using paper. One of the biggest problems with electronic health records is that they are complicated. It takes a lot to learn them. As you see, we've got 7 users in our electronic health record practice. We've got e-prescribing, we've got labs, and about 600 or 550 patients. Now, let's go back over, and that shows you a little bit about the home page, but let's go back over and look at charts. Remember, I opened up my chart earlier so you could walk through it with me and see how the chart looks. You've got flow sheets, you've got diagnoses, and as we've said before, I've got chronic impaired glucose tolerance and paroxysmal atrial fib, which we've talked about. There are many videos on that. I've shared it. If I had any drug allergies, it would be here. If I had health concerns, it would be here. Medications are right over in this section. I'm on Eliquis, metformin. I take pioglitazone several times a month. Livalo. I have something historical here. Let's look at that real quick. That was an old metformin prescription. If you go back and you look at the e-prescribing video, you'll see that I canceled out my old active metformin prescription so I could set up a new one so you could learn how that works. This is a list of encounters. All of this information is right there in the medical chart. Now, let's say I want to go back and find an encounter. I go to Timeline and click on Encounter. And they're all listed right here every time I've seen the doctor, or if I've seen Amy or one of our providers, one of our nurse practitioners, or David Wright, one of our physicians. Let's go back before we go too deep into the timeline. The profile is here. That provides my name, gender, date of birth, social security. Again, as you see, it's grayed out. Record number, contact information, how the patient wants to be contacted, email reminders and messaging for me, payment information, guarantor, the preferred pharmacy under the prescription sections under the patient profile, and the prescription history and demographics. Next of kin, family info, immunization registry. So you see, again, the electronic medical record provides a ton of information if you know how to navigate it. So I hope this has been helpful as you begin to learn what's available to you with a telehealth approach to medicine. So, guess what? You can actually even get really good medicine, quite often much better medicine, right there in home. And maybe that's one of the things we're going to learn from the coronavirus outbreak or pandemic. Thanks for your interest. If you'd like to get great medicine right there at home, give us a call at 859-721-1414 or email us at myhealth@prevmedheartrisk.com. Look forward to seeing you then.